and that.
That was done this morning.
Oh yeah, they did good. They did good. Yeah, I like that. The 3E nurses, did they come and do it, or the nurses on 3F?
Yeah.
Yeah, they did good. This is because you had a hernia repair. You've got some laparoscopic sites.
Right.
The biggest one's at your belly button because they did a hernia repair.
How long ago was that?
2 weeks ago, right?
Yeah.
That's recent.
Yeah, that was this is 2 weeks ago, or 2 weeks ago from tomorrow.
Yeah.
Yeah, so
I thought you had it repaired a long time
I
ago.
don't know.
Jeez.
was the hernia pretty big before? Was it bulging, or not that you really
It
noticed?
was a Audi.
Oh, you had just an outie belly button. Yeah. Yeah, now you got an innie. Good. So it looks good. Nothing was leaking or anything.
Hey.
Do you remember when they did the flush last week? If you don't remember, that's okay. But did they say it went good? Thursday. Yeah, they said it went good. Good.
They waited, eh?
Yeah.
Yeah, they waited.
I'll do that again. We do that because we want to make sure that the fluid that goes in comes out.
So how do you put the fluid in?
Yeah, so I'll walk you through it. But pretty much, instead of just putting a little bit in and then draining it right out, later on when you actually start dialysis, you just put that whole bag in, disconnect, and you let that fluid just sit in there. You would disconnect.
Flop around.
Yeah, it dwells and it just sits in there. You're not hooked up.
Yeah.
And then while it stays in there, it actually absorbs toxins from the bloodstream. And then later when you drain it, it actually, you'll see it'll be like a yellow color. It kind of looks like urine.
Okay.
The solutions. Keep it warm so you don't get chilly. And that's like this. And then you need a pole. And again, you're between there, so they'll go over everything with you. Nice and warm. For the flushes, we put heparin in our bags so that it stays patent and nothing clots up or anything like that.
Huh.
When you go on dialysis, you don't have to put heparin in the bag.
And they had a catheter in me, they just pulled it. And they did.
What's that?
Catheter,
Oh yeah.
that's a fun thing.
Oh, like a Foley catheter in your bladder?
Yeah.
Yeah.
Good way to spend a Friday night.
Not gonna do that again.
Oh, when did they take it out?
2 days ago.
Oh, good. And you've been peeing okay without it?
And it burns like hell.
Yeah. Is it still burning?
Yeah.
Shoot. Did you tell the nurses it's burning?
Yeah.
Yeah, and they don't think you have a bladder infection though or anything like that?
Well, they said they'd look into, maybe.
Hopefully it's, yeah.
Well, I just came through a bladder infection
Oh,
on top of all that.
yeah. Yeah. I mean, sometimes just, having the catheter in can be irritating, but they'll probably want to just check your urine.
Well, that's why we took it out. It was so irritating.
Oh, yeah, those aren't fun.
What's that big needle for?
It's just to put some heparin in this bag. Yeah, it's not for you, so don't worry. That's the one nice thing with PD is there's no needles. So so this is what the bags look like. There's solution. We call these twin bag.
Yeah.
Because there's a fill bag and then there's a drain bag attached.
Yeah.
We call this twin bag or manual.
Right.
And they just work with gravity. Like I said, you're going to be flat. And again, if you go there and start getting flushes, it'll be maybe different. But we always keep people flat after a hernia repair, just because if you're sitting up, we don't want any pressure on those incisions or any leaks or anything like that. But eventually you'll be able to just sit up and do your dialysis. And I put heparin on the bag, so I'm just putting a little sticker. So now to do the connection is kind of the most one of the most important parts, because we want to make sure that no germs get inside. If germs get inside in that tube, it can cause a bad infection because it's sterile in there. In there it's sterile, we don't want any germs. If germs get in, they can actually grow because it's like the perfect environment for germs. It's moist, it's wet, some of the solutions have sugar.
Right.
So I've washed my hands. We're all wearing a mask just in case if we sneezed or anything
Yeah.
like that, nothing
Yeah,
gets
you don't
in.
want phlegm.
Exactly,
into
yeah,
the
it's just such an
environment.
easy way to prevent infection, so make sure, yeah, yourself, everyone in the room has a mask.
Yeah.
I've washed, but I've touched some things, so I'm gonna isogel
Yeah.
again.
And it's your job to make sure everybody reacts this way when they're treating this. Don't take it nonchalant, right?
And the nurses there, they'll go over all this, but
Yeah.
just make it a little more familiar. So I've isogelled. My hands are very clean, but they're still not sterile.
Yeah.
So it's very important that underneath these caps, it's no touch, because underneath that cap, it's sterile. So I drop it. Again, I just connect without touching. It just screws together. And then once, you'll just would feel it doesn't go any further, it's nice and secure. It looks messy underneath, and that's just because these caps on the end, they sterilize the end using iodine.
Yeah.
So that's why it's that brown color.
Yeah.
Yeah. A little bit messy, but it does a good job of sterilizing.
Yeah.
So we didn't touch anything.
Yeah.
So what I'm doing, and this is your PD catheter. The end of it, so the silver part to the end, that's called the transfer set. So if we did end up capping you off, which I'm not sure if we will, we would just put a little cap on the end, and they would later on put a new transfer set.
Right.
These transfer sets, we always change them, and I'm sure it'll be a similar procedure where you go. They change them at least every 6 months, just to make sure everything's working well and nothing starts to break.
Yeah.
At the end of the transfer set, this is called the roller clamp, because it's a clamp that rolls, and you just twist it, and when it's twisted, like so, it's hard to see there.
What,
It's
you're turning
open.
that counterclock?
Towards me, so yeah, where
Yeah.
would that be? Yeah.
Okay.
And then it can only go one way. If you tried the other way, you'd be like, oh,
Okay.
it's not working.
Won't go,
Yeah, but pretty much you just kind of pull it down. When it's open, any old fluid that's in would just drain out. And you can see there's just a little bit there. As expected though, because you don't have any fluid in right now, there's not much coming out.
Right.
But we always open first, just if there's any fluid, we'd want it to drain out before filling.
Yeah.
If it started going into the bag, I'd actually weigh how much.
Okay.
So it's done draining, we'd say, which, I mean, there's not much there, as expected.
That's a white.
Yeah, it's kind of
Yeah.
a yellowish
Yeah.
color, and it actually
Okay.
looks quite clear, which is good. Sometimes, I don't know if you saw in your first flush, sometimes it can take on a pink or bloody tinge, especially right after, because things are healing. But this looks really good.
Okay.
And a little bit of blood the first flush is okay. I'm just going to close it now.
I'm gonna
So
close it.
Yeah, and you can feel it and hear it. It's a little
It's
snap.
snap. Okay.
These are clamps. We're ready to fill, but there's air in this line. If that air were to go inside of
Oh,
you,
yes.
it's not harmful. Like, it's not like if got in your bloodstream or
Right.
something. It's not harmful, but it can be really painful and uncomfortable because the air will float all the way to the top, and you can get
Yeah.
pain up in between your ribs and your sternum, and it can be very
Right.
uncomfortable. So we let the air out.
You bleed it.
Yeah, exactly.
Yeah.
Just prime it out.
Yeah.
So you're closed. You're not gonna get it. I'm just gonna put the clamp on the drain line.
Okay.
The drain line's like a clear color.
Yeah.
This one's blue. That's the fill line. There's a little we call it a frangible, but it's a seal that breaks. You just snap it and open it up like so. And then now I'm gonna let the air into the drain bag by opening the clamp. Oh, a little bit of
Okay,
air.
so it's moving the air.
Yeah, so all the air, you can see the line is primed, there's no air. Now we're ready, so we just open, and now we're filling.
Yeah.
When you are at home, you would let the whole bag go in, but we're flushing. We don't want to do that yet, because we don't want to put any pressure in,
Right.
because you're healing still. So I'm only going to put a little bit in, like 500 mils or less, which is about that much, and let it right out. And again, you're not going to have to do this at home, so don't worry about it, but it's
Right.
nice to be comfortable and familiar with everything, so it's not overwhelming later on. Have your bowels been moving okay?
Yeah.
Yeah, sorry.
No, that's okay.
That's good. That's good. With peritoneal dialysis, for it to work really well, we like you to have regular soft bowel movements daily. What can happen, because this space, the peritoneal membrane, it shares the space with your other organs, including your bowels. So if the bowels get really full, really bulky, they can actually push on the catheter and prevent, the number one thing that can happen is that it doesn't drain out very good. If it got really bad, might not even be able to feel good. Usually though, what would happen, it would go in, but it would get kind of stuck.
Yeah.
Worst case scenario, if people are really constipated, the bowels could actually push this PD catheter up so high. It's, again, you get fluid in, but you wouldn't get it out. And then it can actually get stuck on the hip bone. In that situation, they actually have to do a procedure to bring it down sometimes. So it's really good to have regular daily bowel movements.
That's through diet, proper diet.
Yeah, and if needed,
High fiber.
Yeah, that really helps. If needed too, some people take like bowel care medications.
Yeah.
When you go there, they'll have their medications they use.
I did yesterday at the hospital.
Good. Did they have to give you anything, or you've been going on your own?
4 times running to the bathroom.
Oh, so if anything, you're on the other, going a little too much. Yeah, and that's not good either, right? You don't want to be running having diarrhea.
Yeah.
We wouldn't want you to have that. Did they have to give you any bowel care in the hospital that might have caused it? No. Normally, do your bowels run that quickly or not usually?
No, but
No, maybe just
before
with
the
medications
surgery, I had to do a bowel cleanse.
Mm-hmm.
And then 3 days after, bowel cleanse.
Mm-hmm. Oh, yeah, with this procedure.
Yeah.
Yes, yeah. They like you to take Peglig. It's a lot, isn't it?
Yeah.
It's a lot. Yeah.
Yeah.
Yeah, it just helps everything heal good,
And
but
then
yeah, it's a lot.
especially when you got the flu, pneumonia, and you're sick, you got diarrhea.
And then on top, yeah, that's a lot. That's too much.
Ay.
Yeah, that's true.
And then they slide a catheter in just to top it all.
Oh, yeah, it's a lot. Okay, so that's a scale. They'll let you know what they want you to use. Most people, on our program, we like people to weigh, like you had mentioned, they use a scale to make sure what's going in is coming out.
Yeah.
So chances are when you go there, they'll want you to have a scale to a food scale or something, but they'll let you know. There's some programs that actually don't weigh and they just, they'll teach you whether to,
Okay.
yeah, but every program's a little different. So you can see the bags going
Yeah,
down.
yeah.
So it's about 500 or so. So I'm just going to stop it. And because we're flushing, that fluid that went in, I'm just going to drain it right out. So I'm just opening the drain line and it's just going to drain out. I'll just wait as it goes. Sometimes too, it's harder when you're laying flat because you don't have gravity as much as you're sitting up or standing, but it's working really good so far.
When they did it on Thursday, it worked really good.
Oh, that's good. And if you're having regular good bowel movements, I'm sure it will again.
Ow.
I'm sorry. This tape is really sticking to you. I'm going to try and be careful. I'm going to just take the dressing off and peek underneath here. Good, yeah, it's feeling good. Good. Yeah, that looks good. That's draining good. There's a little bit of dry blood, so I'm just going to put gloves on. But typically at home when you do it, same thing, it's cleaner, it's better to do the dressing with hands that you've just washed and no gloves. You just wouldn't touch right at the site. But again, they'll teach you how they want you to do it. They might get you to wear gloves or do something different. Good, yeah, the site's looking good.
Yeah, looks very pinkish.
Yeah, there's a little bit of scab, but no signs of infection. If it was, kind of that angry red color around, pus, bloody, swollen, anything like that, that would be a sign you need to get that checked. Is there any pain at all?
No.
No, good. I have a little bit of a dry scab, but that's that'll just come off as it heals.
Yeah.
Good. And pretty much, everything came out. We got about 500 out, so that's good. Again, it's good. None of the fluid is leaking out or anything like that, which is good. Hello. Here, I'll just come out here. I'm gonna just put a little bit more in and I'm just gonna peek out the door here, okay? So there's just a bit more fluid filling.